big difference between how Neuroluminance approaches brain disorders and psychiatric disorders and the average doctor. Most doctors talk about, chemical imbalances in the brain, not enough serotonin, and you need to take Prozac, Paxil, or Zoloft for your depression. They talk about brain injuries being, permanent and unchangeable, that there's nothing to do to help the brain get better. And in fact, that's wrong. The brain has its own intrinsic ability to repair itself, what's called neuroplasticity. And so I have devoted the past decade of my life to developing new treatments for helping the brain to repair itself. Ketamine infusion therapy. Ketamine turns on neuroplasticity in the brain repair. Our multi-watt infrared light therapy activates the mitochondria in the neurons in the brain, and they turn on growth factors that help to induce neuroplasticity in brain repair. And the result is that our patients with depression get better. Circuits rebuild, and they're no longer dependent upon taking a pill every day and going to therapy and journaling. They're living their lives with joy and gladness. Our patients with brain injuries are seeing their symptoms get better. Their sleep improves, their memory improves, their mood dysregulation, irritability improves. And we can see it on a functional brain scan. When we look at the brain scan before and the brain scan after treatment, you can see the improvement. Now, parts of the brain that are dead, we're not going to bring them back to life. My name is Dr. Henderson, not Dr. Frankenstein. But the areas of the brain that are limping along, that are just barely hanging on, they get better, they get stronger, they make new circuits, and the brain functions better. And so patients with Parkinson's disease, where every day they're getting a little worse, and every day they have to take a little bit more of their medicine, a little bit more, and a little bit more. When they get treatment with multi-watt infrared light therapy, they need less medicine. They have less tremor. Their gait is better. Our patients with post-COVID fatigue syndrome, with treatment, their fatigue goes away. We had a college student, she was sleeping 20 hours a day, only able to function 4 hours, and she was exhausted even those 4 hours. After treatment, she was going to school full-time with straight A's and working at Starbucks over 30 hours a week. She was out there kicking butt and taking names. And so with infrared light therapy, we are activating the brain's own ability to naturally heal itself, to naturally repair itself. And that's the neuro